views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗁 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗁 on 𝗛𝗏 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗁, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗁. I'm your host, Nicole Jacinto. Today we are here with Dr. 𝗂𝗏𝗁, and of course, he is an otolaryngologist or an ENT. And we've had him on the show a few times. And, I got good feedback about Dr. 𝗏𝗏𝗁 as a guest, so I'm happy to have him again. How are you, doctor?
I'm doing great. How are you, Nicole?
I'm all right. Thank
Nice
you
to be on the show again.
Yes. Come back often. There's so many things to discuss. Sometimes, we tend to ignore. Last week, we discussed something about the eyes, digital eye strain. And then I'm happy that it's pretty aligned. Today we're talking about the ears and of course you also do the nose and throat, but I find that we tend to take our eyesight and our hearing for granted. Because we use it all the time and sometimes we have like checkups and all that, but we ignore certain things that may be happening with our eyesight or our hearing. And it takes us longer to get to a doctor and have it checked out. So today, folks, we're going to talk about coping with tinnitus and hearing loss. So let's start off, Dr. 𝗏𝗏𝗁, by telling people, I'd like to ask you, what exactly is tinnitus?
Well, tinnitus came from the Latin word tinere, meaning to ring.
To ring.
Yeah. It could be an objective one, meaning you can really hear it, and the doctor is able to also to perceive it. Or it can be subjective, meaning only the patient will hear it.
Yeah.
It's inside, it's electrical signals lang. So it's very complex. And usually we characterize it. There are a lot of, if you see the table of tinnitus, it's very varied. Meaning, basically, it's stimulation of the ear by a sound. It could be high-pitched, it could be rhythmic. So, but the most common one na alam ng mga tao is the high-pitched continuous.
Yes.
So,
Okay. So
if you were to ask me, and most of my consults will be that.
there's an expression, I hear ringing in my ears, and that's or in my ear.
Yes.
It's only one, but
Yeah.
that actually really does explain it. And often I'm so happy when someone like a doctor like yourself tells us what the root word of, from the Latin, because these are conditions that were discovered before and
Way back, yeah.
way back. So it's been with us for a long time. And can I ask you, okay, curious, like sometimes it will be you said there's a high pitch, like
Yes.
could sound like that, or like a rhythmic thing, like
Yes.
Okay, so I'm just like making samples because so that, well, from my own experience and also when I ask you, well, what do you mean you hear ringing in your ears? And you said it's electrical impulses and basically stimulation of the ear or ears. Do you
Yes.
usually get it in one ear, or can it be two? Or as we perceive it, can we perceive it in like one side, like the left side or the right side? Does it usually come in greater degrees for one ear more than the other, or can it happen that someone says, I just hear it in the left part?
More often than not, it's on one ear.
Mm-hmm.
Alam mo, this is very common. And I've had most of the patients, they can distinguish
Yeah.
on which side. But some talagang both.
Oh,
Especially, well, number one, well, tinnitus may be a manifestation actually of hearing loss. That's
okay.
why yun yung number one investigation namin.
Mm-hmm.
Uh, because if there's damage to the hearing apparatus and the brain cells,
Mm-hmm.
uh, doon ka nagkakaroon ng tinnitus.
Okay.
So, commonly, it's one. So, based on my clinic experience and also sa studies then, a lot will have tinnitus on one ear.
Okay.
Very rare, but a good percentage will also have both ears.
Okay. So, doctor,
Uh,
you just said, sorry, I didn't mean to interrupt
no,
you.
no, it's okay.
You just said that it can be a manifestation of hearing loss. Can you tell us, okay, and of course jump in and correct me anytime. So what I understand from that is like we can be losing our ability to hear in either one or two ears. And uh, as this occurs over time, can you tell us though what is there a difference? I mean, you told us how it was related to hearing loss, but is there a difference between hearing loss also, or are there other causes of tinnitus that are not related to hearing loss? Parang
Yes.
not automatically losing my hearing.
Yeah. Um, so there are patients and if you see the textbook sa tinnitus, so number one, tinnitus is also deeply rooted with psychiatry. Sometimes
Mhm.
severe stress and post-traumatic experiences may also give off tinnitus.
That's
Strange enough, yes.
mm,
So if you read about the textbook, those pioneers who did research on tinnitus and who still are making research,
mhm.
a lot of them are also psychologists, not just ENTs. Eh.
Mhm.
So
That's very interesting and very enlightening that you said that. I mean, in my own experience, and when I have spoken to others, sometimes people are maybe they have anxiety
yes,
at the moment, or like I have experienced like we're at a concert and maybe the crowd, or someone has been thinking of something and they're like I can't. They seem to not be able to hear well, or they hear a ringing in their ear, and it's not exactly because of the volume of the music,
yeah,
or maybe not a concert. That's a bad example because there's loud music. I mean,
yes,
somewhere it's like, what? I can't hear you. Like, when they're stressed out, or
yes,
people are stressed out or anxious, sometimes they can't seem to, it feels like they cannot hear as
yeah,
well, or they will ask over and over again. But when they're not stressed out, it seems like they can hear better, or hear more clearly, or hear you right away. So I'm very happy you said that, because it's information that can help everyone.
yes.
So
Uh, yes.
go
It's
ahead.
also an aspect na madalas na overlook ng ibang physicians. Normal naman yung hearing mo.
Yeah.
I get some patients na when I talk to them, they really have anxiety disorders.
Mhm. Yeah.
So that's when we really need to talk to the patient and ask them what's really the root cause of a consult. And when you probe,
Mhm.
uh, meron palang ibang underlying cause. So tinnitus is very complicated.
Yes.
So it takes a lot of time and effort and from the patient and the doctor to really get the root cause if there is na
Mhm.
organic and correctable because it's very stressful.
Yeah.
I can only imagine
Mhm.
having that ringing in your ear 24/7. It
Mhm.
can really be stressful.
Yeah.
No,
I think
yun,
you said earlier sometimes it's objective in the sense that, you mentioned this earlier. It's objective in the sense that the patient can hear it and the doctor can also hear it. How does the doctor hear the ringing in the ears, or how can the
ah,
doctor evaluate it? Yes, there is ringing in the ears.
yes. Sometimes if pulsatile, meaning it could be vascular. So you can put a stethoscope nearby or dun sa part na merong pulsatile tinnitus if there are vascular anomalies.
Mhm.
So these are rare conditions naman. So that's why we really need to characterize. So
Mhm.
these are mga strange na pulsatile tinnitus. And also and I've seen also patients with yung rhythmic naman parang drums.
Yeah.
So that one is also different.
I
uh,
sorry, go ahead.
yung yung rhythmic contraction. So I always equate this is palatal myoclonus. So yun yung number one cause. Parang drums naman sa ear. Tak 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 tak. So some patients will also have that. Yung twitching nung I always explain to them, have you experienced twitching of the eyelids? So
Mhm.
ganun din. There's also a small muscles inside the ear that may also twitch, and you will hear that.
That's a
So
great example.
yeah,
Kasi we can say, yeah, I was tired or I got nervous, my eye twitched, but we don't notice if there's something inside the ear
there's
that is
ringing. Yeah.
twitching. Yeah.
I've encountered a lot of patients already. Doc, parang may insect sa loob ng tenga ko.
Oh, that's what I was gonna tell you.
Yes. I've I'm sure you've had a friend or two or a
Yeah.
colleague na may ganun din na
I was
ano.
thinking of someone in particular.
Yeah.
She was saying, parang there's this
Yes.
what does it sound like? Tuk, 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 and then
Yes.
she panicked because when you can get nervous because when she was a kid, an ant went inside her
Yeah.
ear and bit it. So she was like, "Ugh, is there something in my ear?" That is freaky. Diba? If you think, oh my God, there's something in my ear, and then it wouldn't stop. So she said, go see an ENT.
Yeah.
And then it wasn't explained to her this way because she just went to the most convenient place first, and then I don't know, you may have the same diagnosis. Oh, you have allergy. I was like, okay, but what's the tuk tuk? I mean, maybe it's something that all came together. But that happens. That's part of it. That's tinnitus. It's the tuk 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 tuk. Parang your ears are popping, no, doctor, when you
Ta
take
iba pa yan. So
one.
it's very complicated. Yun naman sa steak and tube, yung occasional popping na hindi naman rhythmic. So it may be a steak and tube problem. The tube that equalizes the pressure in the ear and the nose. Yung tube that connects the two.
Okay.
So that naman, well, some patients with dysfunction of that eustachian tube,
Mhm.
they also have some degree of discomfort. More of earfulness yung complaints. Bihira yung nagko-complain ng tinnitus or tinnitus. If there's fluid, maybe, inside. And also, I get a lot of patients with ruptured eardrums
Ah,
who also complain of the ringing because it's a chronic na inflammation naman. Matagal na napamamaga ng
oo.
hearing apparatus.
And we don't, ano, right away, di ba? If we sort of, okay, it's there. I mean, it's
Yeah.
just kind of like human nature and like the way we live our lives. Oh, it's sort of there. Or, if your eyes are starting to get a bit malabo, parang ganun eh. We don't, as long as we can see or hear pa, we don't really like check it right away unless it's something very disturbing like that ringing
Yeah.
or the popping and somebody has maybe experienced it before or it scares them. But usually you'll hear them say, it's been 2 or 3 days. It's not naman something like within 5 minutes they'll tell you na, ano mo yung tenga ko. It's something that they kind of, maybe it will disappear. Okay, doctor. I- uh, I- does sometimes does it sound like, have you ever heard electricity? I mean, like, I don't know, when I was growing up and then go to the province, di ba yung mga wires pa doon,
Yeah.
yung,
Yes.
can it sound like that too?
Yes.
Okay.
I've had patients. So there are also tests to characterize. Interestingly, there are tests to know the loudness and the pitch.
Mhm.
So we have it in the hospital in Makati Med. If you approach us, we can request to match the signal. Yeah.
Yes.
Interestingly, the audiologist will look for the pitch
Mhm.
and the loudness of the tinnitus or the ringing.
I'm curious now if you've had any patients who happen to be like people who have perfect pitch, like like some singers when they sing or classically trained singers, and then they're like, it sounds like this, then they'll tell you the note. Scale
Uh, I have yet to experience a patient na perfect yung
No, perfect yung ano.
yung ano niya.
Okay. So, doctor, speaking of the patients who come in and the type of people that you meet in your practice who end up having this manifestation or problem, how common is it? How common is tinnitus and maybe the start of hearing loss in the Filipino population, or at least in the practice that your practice that you've encountered?
So it's really, so I call it a spectrum. So there are patients who will experience it. So when I ask, so as we're, ang favorite question ko yan. So right now as we're talking,
Mhm.
do you hear it? Doc, hindi. So how often do you hear it? So there are patients na once lang, so they're very anxious. So
Mhm.
mas nag-improve na rin yung health-seeking behavior. So
Mhm.
natatakot ako, Doc, eh. So I've experienced it once, pero hindi na bumalik. So
Yeah.
there are patients na gano'n. So this is very common. So
Yeah.
every clinic, I have at least a few na nagpapatingin with either the mild one and also the severe one. The severe one is talagang it's there. So there are patients na in some nights, especially at night,
Mhm.
pagka tahimik na yung environment, then my brain would focus on the ringing. It's so bad. So there are patients na gano'n.
Yeah.
And they've learned to, most of them, they've learned to cope with it.
Mhm.
Uh, so my job is to rule out yung dangerous causes or organic causes. If there is at least a reversible cause, then
Mhm.
I will go for it. Like
Yeah.
for example, yung ruptured the eardrum, then I will repair.
Mhm.
Or for example, to rule out if there's a tumor. Although this is very rare. Baka na matakot yung audience.
Yeah.
So,
Mhm.
and
Oo.
this is very rare. So less than 1% will have this type of nerve tumor.
Mhm.
Yung we call it acoustic neuroma. So
Mhm.
sometimes yun yung manifestation.
Mhm.
But uh, so sometimes if there's true hearing loss on one side, so
Mhm.
single-sided na hearing loss, so I'll request for an MRI just to rule out that tumor.
Well, it's
So
good that you can
yeah,
rule it out, or I mean,
yeah,
if you need to request an MRI, hindi lang yung parang, oh sige, okay na yan, pwede na yan, wala naman eh. There, sige, you're a
yeah,
good doctor. You will really look for an organic cause.
yes,
Also discuss things with the patient, and sometimes even if you're not a psychologist or a psychiatrist by practice, the patient will open up to you because you're a doctor.
yes.
Yeah. Do you
Alam mo, yes.
do you like ever end up referring or working with let's say psychiatrists in Makati Med or psychologists just to kind of help the patient with the.
Yes.
Yeah.
I've referred a few patients already that have true anxiety disorders. Yung iba, equivocal ako, so I let the psychiatrist decide. That's what I always tell my patients. Of course, it will be the conversation between you and the psychiatrist on
Mm-hmm.
how it will go if you will be given medications or kaya na ng behavioral therapy.
Yeah.
So these things will be the forte of the
Yes.
psychiatrist. That's why it's a team approach when it comes to these conditions.
Yeah. And it's great to know and very interesting actually na imagine people will be like, oh, it could be psychological. Also like I'm not imagining it kasi pag
Yeah.
nervous ako parang hindi ko marinig. And it's true. Baka hindi mo nga talaga marinig because of your anxiety.
Yes.
It's not just in the imagination in a sense. Anxiety can affect us that way. Doctors are a certain demographic of people who are more prone to or more sensitive to or more vulnerable to tinnitus and hearing loss in the population.
Yes. Thank you for that question. Yes, because so not the number one common cause of hearing loss is presbycusis, meaning as we age, humihina yung hearing.
Yeah.
So uh, I would like to surmise
Mm-hmm.
that the older population, and I think this is backed up naman by studies. I've encountered it sa textbook ng tinnitus eh. uh, yung older population will have a bigger percentage because they will have more hearing loss. Eh.
Yeah.
There's their normal degradation talaga of hearing. Eh.
Mm-hmm.
So, I would say karamihan din of my patients mas advanced ng konting age, 50s, 60s. So, but I also get young patients,
Mm-hmm.
pero mas less.
Yeah.
So, correlated.
Okay. Yes, it's correlated.
Yeah.
Okay. True or false? I'll ask you to this.
Yeah.
Um, I've heard a number of people say, well, they're not doctors though, but I've heard a number of people say that, oh, once you hit 25, that's it, your hearing starts going down. I mean, basically, your hearing starts to deteriorate. I mean, they don't say how much it deteriorates, per year or is that true or false?
Uh, no. It's multifactorial. So it's to answer that question, it's quite complicated. So, 10% will have genetic factors, yung
Mm,
hearing loss. But it doesn't onset at 25. It's too early.
sure.
Usually at mga 40s to 60s. Ang earliest na
Mm,
nakikita ko around 40s,
mm,
yung presbycusis.
mhm.
Masyado maaga pa nga yun. Um, at least, so the next factor is yung occupation. So
Yes,
kadalasan,
can I ask you?
yeah,
Okay, so that thing that I've heard several people say once you hit
yeah,
20, I'm like, okay, so that is not true. As a blanket statement, that
yeah.
is not true.
As
Okay.
a blanket statement is not true. The next thing is which population are at risk. So yung may mga occupation like yung exposed sa loud sound. Kunyari, if you're a seaman sa engine room,
Mm,
definitely you will have earlier onset of hearing loss. Next, if you're a policeman, so I've seen a few na nagfa-fire regularly. They have these exercises, and recently I've been given the opportunity to talk at a gun show.
yeah.
Ganun din. So a lot of these people will have high-pitched tinnitus because of acoustic trauma.
Mm,
And that's why I advocate na kailangan yung gumamit ng safety equipment.
yeah.
Hindi pwede yung bala lang na
Oo.
nilalagay
Oh,
sa
and
tenga.
yes, actually,
Yeah,
yes, I've seen that. I have gone firing before.
yeah,
It's been a while, but I've seen people like firing the gun, and of course I've done it too. And what really bothers me is the sound, not really
yeah,
but it's of course it bothers me, and I think it bothers them and everyone. But if they kind of tend to get used to it, and then you have the ear
yes,
muffs in place, although sometimes I'm like, are these really? And then, but I've seen people just put bullets in
yeah,
their ears. Now, okay, here's a bullet, and then bang, 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 then another bullet. That kind of. So, I mean, for those of you who have not encountered that, the
yeah,
doctor can also attest to that. Sometimes you just put
yeah,
the bullets in the ears, and it looks kind of cool, but also it
yeah.
doesn't
It
help.
doesn't confer any protection. There are also other myths
Mm,
na pag open yung environment, it's safer without the ear protection.
mm.
Kasi daw hindi nagva-vibrate yung sound. No. Malakas pa rin yung
Ano eh?
sound pressure level ng gun even in or open environments.
Mm. Doctor,
Uh,
how about people? Oh, sorry, go ahead.
so the next one is ear hygiene.
Mm-hmm.
So people with poorer ear hygiene, meaning uh, malakas makinig ng headphones, lagi nakasagad. So these people will have um, again earlier onset of hearing loss. So
Okay.
yun.
Okay. So doctor, also like I was thinking of stuff like what if you're in construction and you drill and the drill
Yeah,
is so loud. Those are also things or
yeah,
occupations that can maybe affect you. So maybe they should also wear protective gear. You're like and then also you said that people who listen to loud music or have earphones on all the time. Of course, you know that for a while now, and I'm sure since before, we all have been exposed to loud music, or maybe when you're a bit younger, or it's a song you really like to, drive in the car, jack up the volume, or wear the headphones, or earphones. I keep saying headphones because I'm of a certain age, and then now it's like some are like AirPods. I'm like that sounds weird. I'm just saying earpod, you know. um, for for example, okay, in the radio industry, DJs also wear headphones a lot.
yeah,
So that can be I mean, something we have discussed that, like, in our profession, you shouldn't jack up the volume just to
yes,
hear yourself or the caller or whoever too much. And I guess DJs in nightclubs or people
yeah,
who work in nightclubs where the music is just too loud. I appreciate that
yeah,
the music is just right because you can't really converse, or it's already deafening. And I've always been like that. So I mean, I used to love going out, but I could never really take the very, very loud music. But I guess I don't know why it's some of our. Have you heard, like,
Yeah.
if you pass by three different, you're talking about ear hygiene, that's what you mean.
Yeah.
Di ba dito sa atin, you pass by three different stores, you hear three different kinds of loud music playing. Yeah,
And
so
ano so I'm sure you've experienced this when you go out of the loud or noisy concert or yung nightclub.
mm,
Feeling mo parang mahina yung pandinig.
yes, you're like, yes. So
So
alone.
yeah, that's a temporary hearing loss. We call it yung temporary threshold shift. It's a phenomenon na humihina talaga yung pandinig mo. And it can sometimes convert into a permanent hearing loss. So it's also dangerous
So we must
to
really be careful.
continuously be yung mga regularly
Mhm.
na nightclub or concert.
Yeah.
And
So with
I've,
the,
yeah.
sorry, go ahead, doctor.
No.
No, please go ahead. I was
And it's also an occupational hazard nga. So yung mga dancers were dancing near the speaker in a concert or uh, yung DJs nga. And I've also encountered band members
yes.
na playing music for X number of years na may hearing loss din. So yeah.
Probably, especially if you play the drums, because even without any amplification, it's like really loud, and you used to dabble a little in that. Now I just throw things around and hit. No, I'm just kidding. Okay, so doctor, is hearing loss more common now because of? I mean, sure, we have listened to loud music before, and of course, in the olden days, there people could be shouting, or the people who worked in orchestras. And speaking of that, di ba si Beethoven, he eventually lost his hearing.
Yeah.
Um, is it because of also like our gadgets of having like your earphones or whatever they call them? Is that bad in itself to do all the time? Let's say even if the volume is okay, or is that as compared to, let's say, listening to a blaring stereo or stereo pa, or a television set?
If modulated naman, of course, these are the aspects of human life na kailangan talaga natin enjoy, no? Music, so on and so forth, dancing. Syempre hindi naman natin ipagkakait sa people. Basta in moderation. Yeah. So at least yung volume is modulated. Usually naman ang recommendation ng WHO is around basta 60%. Yun
Yeah.
yung reason. And you're right. Hearing loss is becoming more common. That's why we've been getting a lot of more tinnitus patients because the world is getting noisier
Yes,
and more
yes,
polluted because
yeah.
of noise pollution, yung mga sasakyan. Although, yun. So, it's becoming more and more common. These conditions, tinnitus, hearing loss,
Mhm.
vertigo.
Mhm.
Yeah.
Yeah, vertigo. I noticed a lot of people, just there seems to be so many more people who have vertigo. So these things are becoming more common. Okay. And doctor, can I ask you, you do have younger patients, no? Do you find that you will have younger patients with like tinnitus or the start of hearing loss because of the gadget use? Because when younger, sometimes you don't want to wake up your parents or something, so you use the headphones and you blast the music in the room, or you're always on, always online, always either listening to music or having a conversation or watching something or playing a game.
Hindi naman. Well, I've had some who really enjoy the maximum volume. I've had a few, but
Yeah.
not that common.
Okay.
Not that common. But I've had a few na talagang, Doc, I really enjoy music. Talagang sagad yung volume.
Agad yung volume, yeah.
So I warned him, I warned these patients na talagang, oh, if you continue doing that, and they have some degree of hearing loss na yung these patients who really max out the volume.
Mhm.
If you continue on, this is irreversible. So
Okay.
this is irreversible. Unfortunately, the hair cells of the or the nerve cells of
Mhm.
the ear don't regenerate.
Mhm.
Yeah.
Okay.
So
Okay. So, doctor, can some medical conditions also, because people will say, can some medical conditions contribute to tinnitus and hearing loss, or is that hearing loss, sorry, not medications, conditions, is that
yeah.
hearing loss, parang it's just because of the tinnitus, something that doesn't exactly have to do with the ear, but another condition, medical condition, and also can certain medications affect you that way? And is it temporary? Because you will hear, especially in our culture, nabibingi ako kasi nakagamot ako eh. You hear
Mm.
that? I can't hear that well. I'm getting deaf because of my medicine. Is that true? Can that happen? I mean, so that's actually like two questions, but
Mm.
go ahead, doctor.
Yeah, I, I I I get it. Yes, there is such a thing as ototoxic medications, meaning these drugs are toxic for the ear. So we have that medications,
Mhm.
and also other medical conditions. Diabetes, it's becoming more frequent and common, and
Wow.
also prone. These patients are also prone to nerve problems.
Mhm.
Um, that's why some of these patients may also have tinnitus or hearing loss.
Mhm.
And top of mind, uh, yun. Even strong antibiotics, ha. There are some antibiotics. So, totoo yun. So,
Mhm.
ito naman, this is another debunked myth. So, there are medications that are really strong and ototoxic. Not all, but there are medications that are notorious to cause damage to the hearing cells. Yeah.
So medication can actually damage your hearing cells. I'm and then you can incur some hearing loss or
Yes.
so are there medicines naman that parang you're just you don't hear as well because you're on them at the time? Is
Mhm.
that just
Yeah.
the perception maybe of a person? Or let's say it's there are medications that kind of they affect you in different ways, no?
Yeah.
So are there medicines like that parang I feel like I can't hear as well because I'm on a medication, but it actually it clears up after a while.
After a while.
Mhm.
So maybe my take on this is maybe these medications are sedative.
Mm.
Y- yung medications that dampen yung arousal state or yung what they call is consciousness. So baka yun yung
Yeah.
more of those medications.
Okay.
But uh, I've yet to encounter medications na transient yung hearing loss. Usually, pag ototoxic medications, talagang permanent.
So when you're talking about dampening the like sedatives or things that so let's say I'm thinking of like people who are drunk or drink a lot and they're shouting like what, and then we can't hear each other. I mean, is that like part of it because you're kind of sedated in a way, like
Yeah.
it has the same effect. Okay, so not
And
to
it also affects yung viscosity, yung sa balance apparatus. It's true, talagang yung iba nagve-vertigo.
yeah,
That's
yeah.
why you have that spinning sensation.
Because we have that, we also have this like, oh, why is that guy shouting? Lasing siya eh, right? In our culture, why is the guy? Because he's drunk. I mean, so he cannot really hear himself well. Okay. So thank you for answering those questions, doctor. Now, um, for people who have tinnitus or hearing loss, you mentioned the occupations that can also, cause it or contribute to it. What about those who are studying and working? Can you tell us how it affects let's say they have it. Sometimes they haven't even gone to you for a checkup. How can it affect them? I'm sure there's also a psychosocial component to that.
Yes. Uh, there is. So again, I mentioned earlier, it's a spectrum. So some patients will have it mild, and some patients will have it severe to an extent that it'll affect concentration,
Mhm.
yung inability to be productive. Yun yung mga side effects of yung severe form of tinnitus or tinnitus. Talagang continuous, which affects the quality of life. That's why sometimes we measure yung tinnitus handicap index. So there are questionnaires to measure how it affects the life of the patient. That's why we'll have a gauge on how to be aggressive in terms of helping them. Yun yung other aspects of the tinnitus or tinnitus.
Now, I'm just thinking of some students, no, who may have to strain to hear or even at work, and then you have, of course, impatient people, or they say that person is stupid, doesn't understand, they can't hear you
Yeah.
properly. Yeah. So, or Filipinos are very fond of this expression. Bingi ka ba? It's a way of saying, "Are you stupid?" Also, right? So,
Yeah.
baka nga. I mean, there might be something there. So if you really cannot hear, then you have to ask
Yeah.
the question over and over again. Um, Maybe you should get yourself checked out, and maybe people can also be understanding, or maybe if you know
Yeah.
someone at work or in school who doesn't seem to respond, they're not snobbing you. Maybe
Yes.
maybe they're not snobbing you. It's just that they can't hear you as well, as you would expect them to. Okay. So, doctor, how about people like who are not in school or at work, and let's say, they have, let's say they have responsibilities in the house, or they are retired. Do you see this affect them as well, and their relationships or their mood, like, and then eventually, like they'll go to you and, oh, okay, because they have tinnitus and hearing loss. That's why you.
Yes, because this is becoming increasingly more common, yes. So as we age, so I've seen some patients advancing age, retired. I always ask them, so what are your activities? So
Yeah.
how may I help you? Yun yung favorite question ko din. So what service do you want from me? So if they enjoy watching the TV and
Mhm.
hindi nila maintindihan, they turn the volume up. So medyo these are sources of conflict in the household. So or kaya sa conversations sa table while eating. So in these patients that have true hearing loss, so I recommend hearing amplification.
Mhm. Yeah.
And it's been also proven to help prevent dementia. Kasi
Yes.
system related. So it's another important uh, aspect to
Sorry.
these conditions, tinnitus, hearing loss.
Mhm. Yeah, because if you can't hear that well, and then people don't make the effort to talk to you or speak to you in a volume that will help you, or use gadgets, and we can talk about that a bit later for hearing amplification, then you get left out, no? You get kind
Yes.
of isolated, and then you don't participate in the conversation, not because you don't want to, but you can't really hear, and many people are shy to say, I can't really hear you, or to keep asking, what did you say again? I beg your pardon. It's kind of hard to follow conversation sometimes. So, just a reminder to people out there, treat your elderly and your loved ones with some care, and be more patient, and maybe they can't, they can't exactly hear you as well.
Yeah.
So make it we hope it's not a source of conflict, and maybe be more inclusive in your practices, and we'll get to some of those things a little bit later. Doctor, we just have to take a short break. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi! This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘁𝗵. Available for outpatient care services, our 𝗛𝗶𝘁𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘁𝗵 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘁𝗵 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘁𝗵.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, folks. We're back in Healthline with Makati Med. Doctor, before we continue our conversation, I'd just like to read out this announcement, which we also talked about last week very briefly. I just want to congratulate Makati Med, for the 3 honors that they received in the 21st Philippine Quill Awards. And so Makati Med earned these 3 distinguished recognitions at the 21st Philippine Quill Awards, which was held on August 27, 2025, in the Manila Hotel. And these awards and these recognitions, they underscore the excellence in communication, innovation, and corporate responsibility of Makati Med. And Makati Med was also honored for its 𝗛𝗶𝘁𝗵 robotic surgical system. And the hospital's 2023 annual report, which is titled Breakthrough, Recognizing Opportunities and Reinventing Innovations, and its environmental, social, and governance program, webinar series, and sustaining initiatives. So, with these 3 prestigious recognitions, Makati Med has reaffirmed its leadership in healthcare communications and its unwavering commitment to excellence, sustainability, and innovation for the benefit of its patients. The stakeholders and the community that Makati Med serves as well, whether you've just been there once or you've never been and you go for, to the ER, you try it out. This just strengthens it affirms how prestigious and how hardworking the teams in Makati Med can be when it comes to their different departments and programs. So okay, doc. So you're part of Makati Med. Congratulations, doctor. Okay, doctor, talking about tinnitus and hearing loss and coping with it. And you told us what tinnitus is. Of course, we all understand hearing loss. Doctor, can I ask you something though? Have you when people are born deaf, or can you actually explain the term? When people say someone was profoundly deaf, what does that mean? Are they completely deaf? Can they not hear at all? I mean,
So, to answer that question, so there is a classification, there is a measurement. So we measure the hearing loss in terms of decibels. According to the World Health Organization, if you can't hear yung 80 decibels and above, this is profound hearing loss already.
wow.
Meaning profoundly deaf, and you're not able to perceive speech anymore.
Mhm.
So these are the impacts that we consider for profoundly deaf individuals. And yun, yung sudden onset of being profoundly deaf may also have tinnitus. I've
Yes.
encountered patients, yeah. Again, going back to the
Yeah.
manifestation, yun.
Or sometimes because you can just hear,
Yes.
you hear that and you can't
And
hear.
imagine having that continuous,
Mm.
it can really have an effect on your life. basically you wouldn't be able to concentrate, even sleep. In
Yes.
some people, yeah.
Okay, so doctor, how do you diagnose it? Both tinnitus and hearing loss, and how they're related. How do you actually really diagnose it very thoroughly and properly? Like, what do you do when you encounter a patient? And
So when I encounter a patient, so the first thing I do is I get the story of the patient. So it's a good history, and the next part is um, taking a closer look at the eardrums if there's a problem, visible physical problem, like a perforated eardrum. Is there a tumor
Mhm.
inside the ear? Um, and the other parts of the ear, nose, and throat. And the next part is requesting for a comprehensive hearing test,
Mhm.
and um, with or without tinnitus matching. I've mentioned earlier that
Mm.
it's an option to have your tinnitus tested, yung kung imamatch siya, to quantify and yung loudness and yung pitch.
Mhm.
Um, the next one will be counseling. If there's a correctable reason, then
Mhm.
I'll go and try to correct that.
Mhm.
And there are
Mhm.
correctable, and or at least to help minimize the sound level. And the next aspect, if is there are there options,
Yeah.
like some, for example, hearing aids,
Mhm.
and uh other examples,
So this is like how
medication.
you
Yeah.
treat it, how you treat the tinnitus and
Yes,
hearing loss. Okay, so
tinnitus,
you
hearing loss.
like hearing aids, medication. There's also medication to treat it, right?
um the success rate for medications for tinnitus is quite low, but I always explain so to my patients, if you want to try, you have that liberty. So then I will prescribe. So I always decide. So I always empower my patients uh, to also decide in what route they're going to.
So it's not a hopeless case. And by the
Yes.
way, but I've never heard of medication for it. What do the medications do in order to help the patient? I mean, for
Oh.
example, some instances when you think, you recommend medication and the patient says, "Okay, I want to take it." How do they help with the tinnitus and the hearing loss?
Well, for one, I'm sure you've heard yung ginkgo biloba.
Ah,
Uh, it's for neural health, although it's herbal.
hmm.
Also, some doctors give it. In their studies, about 10 to 20% the success rate. It's quite
Mhm.
low
Okay,
in terms of lowering the level of the tinnitus.
okay.
It may or may not be placebo. I don't know if you've heard of the term
Yes, the
placebo.
placebo effect. Yes.
So, um, and for example, if the tinnitus is pulsatile, so we give beta blockers if it's intracranial hypertension. This is mga weird na mga
I
diseases.
don't know. Could be high blood pressure, and
Yeah,
but people say,
the brain and ano, yeah.
yeah.
So sometimes beta blockers can be given, yung mga antihypertensive. So these are things that can be discussed. So it's
Mm.
really tailor fit. It's not a one drug fits all. So yung that's another aspect na baka isipin nila, oh, ginkgo biloba sabi ni Dr. Lapig.
Inumin ko na lang, no? Yeah, you have
It's
to.
really not a one wonder drug that for all. Yeah.
For the nerves doctor, do things, for example, I mean, I'm just things like vitamin B complex, so they're supposed to help our nerves. Is that helpful? So some people, not saying it's a treatment, but
Yeah.
some people take it as supplements for other things. They say to take care of the nerves and all of that. What do you think of that?
Mm, alam mo yung
Naging kabila.
sobrang vitamin B complex is
Oo.
also not healthy. Eh.
Yeah.
Yeah. So we give it for again nerve na conditions if it's indicated.
Mhm.
But if as a prophylactic, I'm not fond of. That's just my take on it. So
Oh.
I'm not fond of giving it left and right. But
Mhm.
for some conditions, yes. For example, with true nerve conditions, yeah.
Mhm. Yeah, because sometimes, these days we also tend to overdo the supplements. That's just my opinion too. Tend to overdo the supplements. There's so many supplements. I'm not saying just go with medication.
Yeah.
Supplements can help, but you also have to check how they interact with each other. Is this really helping? I mean, it might be such a high dosage that you're taking, and it's also affecting other parts of your body. You could hurt yourself. Or the thing is, it's a supplement, so it's not. It's who knows? Maybe later on, a supplement could be a cure, right? But it would have to be, measured and put in that amount, or what exactly. I mean, because if we just overdo things, because you mentioned ginkgo biloba, so I'm like, I've heard of nerve stuff, and people will just also take be this, be that, be this, be that, vitamin E, vitamin C, everything na, and including those like one-stop shops, like this is good for your brain. I'm like, how is it good? Baka may caffeine lang yan, kaya nagigising yung tao. I get skeptical. There are good supplements and good vitamins, and doctors prescribe them a lot too. It's just that it's just a warning also to to people that you also gotta watch what you take, and you can't put it in place of certain medication. Sorry, that was my take on it. As a
Oo, alam mo, in excess, there's also that risk of yung people undergoing major surgery or emergency surgery, mas madugo. There's an increased bleeding risk. Yung excess ng mga herbal supplements. There are herbal supplements that are notorious to have that effect on the body then.
Yes, that's right. Like if you maybe you don't realize, take ginger, too much ginger, supplement and then ginger, then you eat ginger also, and then
Yeah.
well, you're gonna go through surgery, or you have a wound, the bleeding, or it's like or maybe St. John's wort, which also anyway, I'm not really a vitamin expert, so I'll stop now. Plus, we're talking
Yeah.
just you know
So,
but because as the doctor will tell you, okay, even a dentist, don't take this first, right? Like, don't take any blood thinners or aspirins, pero yung pala you're taking a lot of supplements. So just a warning out there, to people out there. Okay, so doctor, um can you so is there a cure for tinnitus and hearing loss? Can it be reversed?
um, for tinnitus and hearing loss, the root cause needs to be identified first. Um, Unfortunately, as I mentioned earlier, there's no one
Mm.
drug and one procedure that can cure or totally remove tinnitus.
Mhm.
So it's a tedious process.
Mhm.
Uh, there are causes that can be treated. That's why it's important to really seek professional help. You consult with ear specialists, ENT specialists,
Mhm.
um, to really know and understand the condition. So that's the important aspect in tinnitus. Mm.
And for hearing loss, is there a way to, I don't know, maybe in some conditions, can you do surgeries to reverse it? And but sometimes you don't recommend it.
Hmm.
There are examples of ways to, I guess,
If
cure it.
if the hearing loss reaches a certain degree na talagang profound, even severe, yung hearing loss. So
Mhm.
there is such a thing as implantable technology, yung cochlear implants. I'm sure you've heard of it once or twice.
Yes.
It's embedded technology in the body
Mhm.
that sends electrical signals to the hearing apparatus
Mhm.
and to the brain.
Mhm.
Um, that's the isa siya sa mga para sa akin na life-changing na technology in the past 5 decades maybe. It started in the 1960s. Ano siya, interesting. Um, so this is being done for profoundly deaf children so that they can speak. Kasi kung profoundly deaf, hindi sila makakarinig, so they won't be able to mimic speech.
Mhm.
So this was invented for that purpose. Now it's being extended yung indications to middle age na mga bingi
Mhm.
and also mga matatanda, elderly, who have hearing loss that is so severe na hindi na kaya ng hearing aids.
Mhm.
And sometimes in a certain percentage, It helps with the tinnitus, yung cochlear implants, for severe cases na talagang may hearing loss.
For the surgery, first you evaluate. Is your first line though to recommend a hearing aid for, let's say, someone who's older?
Yes,
Yeah.
there's usually naman yung route sa modern medicine. So we start with the conservative management, so non-surgical. Then as we go further along the taking care of these patients, if the conservative management or the non-surgical options don't work, then we slowly progress into the more surgical or more aggressive types of services.
Mhm.
Yeah.
What's the would you have any, or just, a guess or any kind of, the oldest person you've put a cochlear, or that you know of, they've put a cochlear implant in?
For here, hindi pa masyadong accepted in elderly population eh. Kadalasan yung most siguro 90 to 95% of the implantees here in the Philippines are still the children. Eh. But in other countries, I've seen
Mm-hmm.
as uh, old as 80.
Mm-hmm.
So,
To get,
but I've also seen presentations. So nakikita ko lang sa mga international meetings. Mga 85 even eh. But sometimes, ano na siya, medyo delikado na. Very fragile na yung individuals that are in that age.
why would it be why would it be delicado? Why would it be maybe at risk? Like, how does the surgery go? Can you just very shortly, like, do an overview of the surgery, so even those with maybe children who
Yeah.
who have hearing loss, they can sort of understand what the surgery is like. I mean, people might think like we crack open the head and
No. So,
I
just
describe.
to clarify and also explain briefly, so the incision is hidden behind the ear.
Mm-hmm.
So, we take out a piece of the bone. So, nagdinidrill namin very gently.
Mm-hmm.
And we look for the hearing apparatus, which is the cochlea. Yung snail shape. Yan. Yung tinuturo sa akin sa grade school, yung hearing apparatus. So it's deep inside here.
Mm-hmm.
Then we insert a part of the implant. So it's very thin, a few millimeters thick. Um, and ini-embed namin dito yung
Mm-hmm.
silicone wrap na processor.
Mm-hmm.
So, yun. So, it's really embedded dito sa likod ng tenga. So, it's a very small incision naman. Not that big.
Yeah. So that's good to know, doctor. And it's not like going in here because people get diba? So it's behind
And
the ear, small
and
incision.
it's done under general anesthesia. So, ano naman,
Yeah.
tulog yung patient. So,
Mhm.
this is major surgery.
It's major surgery, okay. And but do patients who get this tend to stay long, or they are in the hospital, or is it just like you're watching them if they have other conditions that they're at risk of, maybe.
Usually, these patients stay for about 3 to 4 days inside the hospital. Then they go home. And it's really not that hindi sila yung parang ini-imagine. So,
Yeah.
kadalasan, so I've understood recently na kadalasan yung mga patients who are anxious about undergoing surgery, ini-imagine nila yung surgery na talagang 2 weeks kang nakahiga
And
and
the TV, and then everything gets cracked.
TV lang, you're being fed by your relatives. So it's really not that bad of an experience. So, and my patients know afterwards, ang always, most of them say na, it's not that bad pala, doc. Yung surgery, yung ear surgery, yung ENT surgery. So it's, hindi siya yung talagang debilitating na talagang, ano ka.
So I hope that if there is anyone watching who's considering it, or maybe people who are considering it, or please go to Dr. Lapina to have your ears checked anyway. And if there are any problems, and if this is a consideration, it's not that bad. That's what this patient said. It's not that scary. It's not gonna crack open your head or drill through your ear. Okay. So doctor, when should someone consider going to to an ENT or to you if they're experiencing like some ringing in their ears or a bit of hearing loss. As I said, sometimes we don't catch it quite quickly. Yeah, that's a lot of people say, hindi, natural lang yan. Kasi medyo tumatanda or, baka ganun lang, which is a bit dismissive. In my view,
Yeah.
my personal view, it's really dismissive. Like, okay, let's not bother because it, of course, yes, it's a natural process of aging, but something can be done about it and the quality of life. So what should someone consider going to you?
What you mentioned earlier, of course, initially sa mga workplace, if you see and notice yung mga workmates mo and your family, your relatives na ang makaka-notice talaga, number one dyan yung relatives for patients with hearing loss.
Mhm.
Ang hindi manonotice madalas ng patient. So
Oo.
yung relatives talaga yung mapaprompt na you really need to have a consult with any of ENTs naman sa Makati Med are well-trained and experts on these topics. So they can approach anyone. Tawag dito. So if you notice, if you notice your relative na talagang hard of hearing na,
Yeah.
so it's about time.
Yeah.
Recently I bought my father hearing aids na din.
Yes.
Kasi nga nahihirapan na siya na makarinig. So I personally had him tested. Tas, lo and behold, moderate to severe hearing loss. And I bought him hearing aids na.
Mhm. I
And
have
he's happier.
yes.
Hindi
I
na socially withdrawn. Yung sabi mo earlier, it's true. That talaga nagiging socially withdrawn. Hindi na included sa conversation. They would tend to go inside the room lang.
mhm.
Yeah.
I have done the hearing test for a baseline. It was years ago. I'm going to go and check again. Of course, I'm going to go to Makati Med and check again. And I've seen people. I've been with people who acquire hearing aids. One was also in another country. It happened to be in another country, and it really it's nothing to be ashamed of because there's also that. And I know people who are my age or younger, they actually wear hearing aids, and I think that's great because they're in that stage of life where they're working, they've got their kids and stuff, and then maybe some of them at first are like, "What? I have to wear hearing aids already?" But hey, if it helps you, can using hearing aids also sort of, I want to ask you this, prevent hearing loss in a way? I mean.
Ah, ano siya? It's a double-edged thing, yung hearing aids. Kasi if you amplify too much naman, kasi nga there's been recent studies that it causes very mild also na hearing loss
Mm,
if prolonged na use. That's why it also needs to be adjusted
yeah.
once in a while. It doesn't prevent the hearing loss, but it actually helps. Ang studies naman, there are a lot of proponents on these sa US.
Mhm.
Uh, it helps stimulate. So it prevents the dementia and the individuals being socially withdrawn, but it doesn't actually help prevent the hearing loss.
Okay.
Yes.
So it does need to be adjusted at some point just to,
Yes.
inform people, baka you think okay na, okay na.
Yeah.
You always do have to check and um who who knows, surgery may be an option. If you strain to hear, is that bad for your ears? I mean, it's like I know if you strain to see it, the actually
Normally,
harder, but
so hindi siya parang muscle, not like the eyes and that you can squint or at least yung strain, like yung voice that you can strain.
oo.
If you have that feeling of you need to strain or you need effort to hear, baka
Mhm.
may some degree of hearing loss to
Okay.
begin with. So,
Okay.
it's not like a muscle. Hindi siya parang yung voice or yung eyesight that you can
Yeah.
strain.
Yeah, so okay. It's you who's training to hear. It's
Yes,
not your ear
it's
that's
you
training.
extending that effort to hear. meaning there may be some degree of hearing loss. Again, it's also a prompt for consult.
Okay, so you know what? I will be seeing you soon if you don't mind.
Sure, no problem. You're
I
very well.
also bring for a checkup, and there needs to be some adjustment. I just, want not for me, but for someone else. So I will go to you, and I'll get your number after the show. But anyway, so you see, I trust you, and will I hopefully we can help some people. And guys, please do go see Dr. Lapina and other ENTs as well, who are great, who can help you when it comes to hearing loss and the or tinnitus and other ear issues. Doctor, is there anything like can you give advice or anything you'd like to say on how to just sort of cope with it or help prevent it? And for anyone who's considering, like, maybe I should go, maybe they have this, or they know someone who has it. Anything you'd like to say?
Uh, so for the audience, if you are having doubts and if you're experiencing these symptoms, you're very welcome to consult with the ENT specialist in Makati Med. And usually, don't be afraid to seek ENT consults. Mababait naman lahat ng ENT sa Makati Med. So don't be anxious, don't be afraid, it's better to know if there's a problem earlier than to let it be and mas lalala pa. Yeah.
It's funny because I think before people would go more often for checkups with ENT and ophthalmologist because it was more of a standard thing. And then they would be more afraid of going to doctors for more serious conditions. Of course, people are still afraid and hesitant to go to doctors for more serious conditions. But in a way, I feel that people have taken it for granted. Even me, I'm like, oh, I haven't been to my eye doctor. I haven't, had my ears checked in a while. Whereas when we were kids, our parents would take us, So I'll get my mom to take me. Okay. Thank you so much, doctor. Would you like to say hi to anyone before we say bye to the audience for this for today?
Of course, to all my family members, and again, thank you, Nicole, for having me again on
My
your
pleasure.
show, and to the whole ENT department, ENT family, and the center in Makati Med, and all to the audience. Thank you for listening and having this day and sharing the time.
Thank you, doctor. Tata, I love you. Mommy, I love you. I know you can hear that now because you'll be watching with your hearing aids, Tata. And also, hi to your dad, Dr. Lapina. And it's great to talk to you again. I hope you come back soon and we discuss more things about the ears, the nose, and the throat. Okay, so folks, that's it for today. Thanks for tuning in. We'll see you again next week on Healthline with Makati Med. Bye now.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.